This week I've decided to go full circle and focus once again on those staff whom everyone knows have been at the sharp end during the COVID pandemic, and that's our wonderful nursing staff. It's hard for me to shine a light on each individual ward. There are 54 wards across our hospitals, but within each and every one of them we have such fantastic registered nurses and amazing healthcare assistants, and we saw this back in May when we celebrated the International Year of the Nurse. We employ around 4,000 nurses and healthcare assistants across the two trusts, and this will represent nearly half our staff within the new merged organisation. Each of them is providing dedicated, compassionate care to a wide range of patients from different backgrounds, with different conditions, and all at different stages of life. It's our nurses who are there for them at that particular point in time, caring for them, listening to them and supporting them and their families in whatever way is needed, depending on their individual circumstances. What a fantastic group of people. Thank you so much for doing such an amazing job. You make us really proud every single day. But why just take my word for it? Let's hear from some of the patients themselves.
Since I've been in here, they've looked after me so well, and they've given me medicine, tablets, and I've taken everything, and now I'm going home later today.
Lovely, the staff here. They're so caring, and they put you at ease, which is what you want. You don't want to be nervous, you want to be comfortable.
So I've been in 9 days, and right from the outset when my waters broke and I came in, they have been absolutely brilliant. I've been always informed, and the midwife was absolutely brilliant in there with me.
I couldn't have been better looked after. They've been wonderful to me, wonderful. And I'm glad to get home because I miss my cuddles.
In other news, we were delighted to learn last week that the BCP Council had approved our planning and application for the creation of our new maternity, children's, emergency and critical care centre on the Royal Bournemouth Hospital site. This is a hugely exciting development, recognised as being a once-in-a-generation opportunity to improve local health services. I hope that you've all seen the great brochure. Now, this describes the plans for the site, including comments from so many of our senior clinical leaders at Poole Hospital who are so looking forward to moving into their new facilities. The new purpose-built maternity unit with a purpose-built children's unit on the floor above. The enhanced emergency department, 3 times the size of our existing facilities, and a brand new critical care unit with capacity for up to 30 beds. As part of these plans for the site, the multi-storey car park will be expanded and a new pathology hub will be built to provide laboratory services for the whole of Dorset. Environmental sustainability is central to these developments, and the Trust has committed around £1 million to support the provision of more sustainable and healthy travel options. We've reached a truly significant milestone, and securing planning permission allows us to unlock over £250 million worth of investment into Dorset. These funds will benefit the NHS and the public for many years to come, and will create around 400 jobs in the building sector to support the local economy. We've got plans to significantly develop all 3 of our hospital sites. The BCP Council have approved our planning and application for Poole Hospital theatres, and we've started clearing the management corridor to make room for the pathology team, and that will make room for us to start on the theatres. The planning application for the Christchurch site and the development of the new Macmillan unit was submitted in March this year. Thank you to everyone who's been involved in reaching this important milestone, especially our estates and capital development team. Finally, I want to give you a quick update on our plans to merge and the creation of our new organisation. This week we had a really busy joint board meeting, and we've approved a number of important documents as part of the merger transaction process. We're now looking forward to our board-to-board meeting with our regulator, NHSI, in August, before the merger is formally approved in September. Both councillor governors will officially vote on the transaction on the 15th of September, and assuming all goes well and all goes as planned, the University Hospitals Dorset NHS Foundation Trust will be established on the 1st of October 2020. So in closing, whilst lots of things are looking up and we're all feeling more positive, please remember that we're still in the early phases of recovery after COVID. This means we mustn't take anything for granted. We must continue to stick to the guidelines regarding personal protective equipment, and we've got to make sure we stop and control the spread of infection both inside the hospital and outside. So please, do stay safe, look out for each other, and make sure you have time with your friends and family over this summer period. Thanks everyone.